So end of first week, problems, we were anticipating more problems, to be fair. It's not been as bad as expected. We've had plenty of meetings to start off with and discussed every potential outcome, who could see which patients, which ANPs could see which age groups. But all the staff have been involved, from reception, nursing staff and the GPs. And the main anticipated problem, I guess, was how patients would perceive them being asked personal questions about the reason for their appointment. But actually, at the end of the first week, we haven't had any problems. People have been happy to reveal small amounts of detail in order to get the correct appointment. I think it's been good having a fewer number of patients to see. I think I'm someone who probably runs over quite a lot, and so I've probably finished about the same time without the delay in seeing people. I think some of the GPs who are very efficient and run to time possibly found it a bit frustrating for shorter cases that have been seen by them, and then a bit too long a gap until the next patient. But those are few and far between, and I think that will improve with effective triage, and actually those patients probably didn't need to see a GP in the first place.
Seeing fewer patients, it does mean I do finish the clinic slightly earlier. It allows you to be able to complete paperwork, for instance, letters and referral forms or pathology. You can do as you go along with the patient, rather than having to sit with six referrals to dictate after a clinical session, which is probably better that it's done at the time with the patient in front of you. Secondly, we're running more multidisciplinary teams in the surgery, so in that 15 minutes you might need to go and see a patient that the ANP is seeing or the ECP is seeing, and it gives you that chance to see them and sort out another patient and not have a building list of patients waiting for you outside your room. I think a big difference that patients notice is from their care navigation, so being asked more questions when they call up for an appointment is a big change for them, as well as our receptionists, now care navigators. So I think rather than calling up and saying, okay, here's your 10:30 appointment with Dr. X, you now have a series of questions to clarify whether you're best suited to see a GP, see an ANP, potentially have a query go to your prescription clerks, or simply be redirected to the local community chemist. As an appointment style for GPs, it's definitely a step in the right direction. Sort of rushing through in 10 minutes, it just gives you that little bit of time to ask that extra question or have that bit of paperwork or help out with one of your colleagues who needs a GP opinion. And like I said, there's lots of other aspects to it, but I'd say that's a big positive.
PPG has been very involved in the presentation materials and letters that we sent to patients to try and ensure that they're going to be helpful to the patient. It's very easy for professionals to sort of get into professional trees, and it makes it difficult for a patient to understand. So we've been trying to help it and make it more applicable so that patients can understand better what it's all about. The comments that we have had is that it works reasonably well, in that they can get to see an advanced nurse practitioner without too much trouble, and when they really need to, those advanced nurse practitioners will put them on to a doctor. But equally well, if you talk to the receptionist about it, and if there's a real need, the receptionist will get you to see a doctor. It gradually will hopefully move away from that 8 o'clock queue thing, where you feel you've got to be there at 8 o'clock if you want an appointment.
So just to summarise our thoughts so far, overall been a very productive pilot to try, and hopefully improvements will continue. It's not been without faults, but let's try and summarise what we've done. It allows more time for us to deal with complex patients, and that is better for GPs and for patients. There's no denying that. Seeing fewer patients per session for a GP means that these patients who would have normally been seen need to be seen elsewhere. For instance, rather than 16, 20 patient clinic, it may be a 10 or 12 or 14 patient clinic. And so that leads to a lot of triage skills from reception or care navigators, as they're now called. I guess part of that is realising that many problems aren't suitable for primary care. And this needs a big drive, a really big drive in managing patient expectation, but also a drive for other healthcare professionals and social care about what primary care is actually here for. There's also a few logistical matters which have come up. So we were expecting a bit more from the online triage. We've had to curtail our online booking, as when we started our system we were promised the online triage for patients would be up and running within a few months. And unfortunately we're still waiting for that. And I think it's being delayed alongside the development of the NHS app. But there's no point us having a triage system at reception if people can just simply book online without being asked a question at all. I think it will look back at trying to churn through, and it was churning through, and you hate to treat patients like numbers, but you were just trying to get through a ridiculous number of patients in 10-minute slots a day, and that's simply not good for patients or doctors. So all of those have been a very positive aspect to their 15-minute appointments, and I wouldn't envisage trying to go back to the 10 minutes, in all honesty.